Facebook Friday. My name is Kate Wakelin and I'm from Neuroendocrine Cancer Australia, and each Friday I come in live to our private discussion group and broader community just to address the topic of the week. So it's lovely to be here today. It's Friday the 18th of June. Just before we continue, I just want to pay my respects to the traditional owners of the land that I'm broadcasting from, which is the land of the Braun people of the Kulke Nation, and just want to take this opportunity to acknowledge any elders present, as well as past elders and those who are emerging. So it's lovely to be here this morning. Today I'm going to talk about a topic that is really very important for many people, very present for many people, and very relevant for many people with NETs, which is the topic of anxiety and managing anxiety in the context of NETs. Now, like all of the videos you'll see in Facebook Friday, the information that I'm talking about today can only be general. Of course, I can't know about your individual situation, and so if this raises concerns for you, or you've got questions about your own management, please do talk with your own treatment team. It's really important. The other thing I would just mention is that it's quite an emotional topic, talking about anxiety, and when we talk about things that are related to mental health, it can remind us, I guess, about the things that we're struggling with or that we find difficult. And so you might decide that today it's not the day for watching a video about this, and that's absolutely fine. You might decide to come back to it later when you've got a little bit more time and space and, brain space to be able to process. So it's absolutely fine to skip out on watching it live if you don't really feel up to it. But lovely to have you join me live if you like, and I'll be watching the comments and seeing if there's questions that come through as we talk. So we know actually anxiety is the most common mental health concern for Australians. So it's actually, that was something that I just found out when I was doing some little bit of homework leading up to today's session, and that was a surprise for me. I think I probably had assumed of people in Australia experience ongoing anxiety, and so that will mean that because people with NETs in Australia represent people in Australia more broadly, we'll have people with NETs who already were struggling with anxiety. It's in the background, and others it's in the foreground, and I'm just playing with my internet because we are okay. I went offline, my computer told me, but it's back. You'll notice I'm in a different place because I'm in the middle of house renovations at my place, so I'm camped at at a family member's, and their Wi-Fi apparently is just as dodgy as mine. So anyway, we'll see how we go. It looks like I'm still with you. I've got some people who look like they're still watching, so we'll just keep barreling on. So I was just giving a little bit of background to anxiety and saying that it's one of the most common mental health concern for Australians broadly. So, and what we know is that it's part of the normal emotional response to when something is very very difficult in your life. And so and actually probably those who are experiencing cancer would say that that's probably, for most people, been the most stressful thing that they've ever needed to deal with. Not everybody. I know that some people say, look, this is big, but I've had other big things or bigger things, which is pretty extraordinary in their lives. But certainly for many people with cancer, this will be it. This will be the most stressful thing that you will have been through and might go through. So it's part of the normal range of response. And what we know with anxiety is that it's part of our body and mind's kind of emergency response system. And so it's actually, we're hardwired to deal with threat with an anxious response. And what happens is that we get a psychological response, so we become more watchful, we can become more alert, we don't sleep that well because, I guess caveman, cavewoman Kate would be thinking, oh, maybe there's a bear coming to eat me, so I can't sleep very well. So watching out for danger is what we're kind of programmed to do when we're feeling anxious. But also physically, there are a whole lot of responses that happen, that are awakened when we're feeling anxious, and certainly things like racing heart, dry mouth can be a symptom. Sometimes muscle tension and trembling. And I have to say, when the Wi-Fi died, that was, what happened to me just then, but that was, on a tiny scale. So racing heart, shortness of breath can be a symptom because your body's trying to oxygenate, trying to feed the muscles that might need to run away from that bear. So we get a physiological response, a physical response, as well as a psychological response. And one of my tips for dealing with anxiety is that sometimes when things are really difficult and complex, it can be difficult to disentangle what's going on in our minds, our thoughts and our feelings. And sometimes we can become of the symptoms in our body before we realize what the feeling is. So if you have times where you're experiencing some of those symptoms, like racing heart, tight in your chest, difficult, shortness of breath, increased muscle tension, jittery, irritable, not sleeping that well, then it's possible that anxiety might be part of that mix, and that you might not be really realizing it. So we know that anxiety is very, very common for people when they experience cancer, but we also know that in NETs we've got a couple of extra complicating factors, as usual with NETs. So we know that about 50% of neuroendocrine tumours produce hormones of their own volition, and there's other videos that are all about that, so I'm not going to go into that in great detail. The tricky thing is that some of those hormones can also cause those reactions. So we know that if you're having a serotonin rush, you may get racing heartbeat, you may get shortness of breath, and you might get actually increase in anxiety. So there's with NETs, there's the psychological adjustment and getting your head around, being told that you've got cancer. But also the cancer is potentially producing hormones that might be making that anxiety worse. So coupled with, when we talk about anxiety, we're usually talking about people who are not feeling safe. They're feeling like their existence might be under threat. The hormones can lead your body to really worry and think, gosh, I'm getting this racing heartbeat, I'm having shortness of breath, I'm getting a bit of wheezing, is something really terribly wrong with me? And so that can add to the feeling of anxiety. And it's sometimes like you're not sure which is the chicken and the egg. Did the hormonal outpouring lead to the anxiety, and is that getting worse because of the hormonal outpouring, or is that because you're noticing that you've got symptoms of anxiety and that's making you feel more anxious? So it is really complicated. And there's only so much that I'll be able to delve into in this short video. So I'll make sure in the notes there's plenty of reading. Now, I just will say that there's no comments coming up on my feed. I think that's probably because my internet's dodgy. I'm really a bit sad about that, because I would have liked to have seen the things that you're saying about your own experience in the private discussion group. But what I'll do after the video is stop by those comments and just answer them individually if I can. So with anxiety and cancer, we know that usually there's a lot of people with NETs will have anxiety related to, in the lead up to a diagnosis, related to knowing there's something wrong and not necessarily getting to an answer quickly. And we know that's really common with NETs. So people with NETs it might be several years that you're living with the symptoms of your disease before we actually work out why you're feeling like that. And that can be both anxiety provoking because of the hormones that we talked about, but also just anxiety provoking because you're not feeling necessarily like getting to the bottom of what's wrong. And sometimes people don't really feel listened to. They might feel dismissed. They might have social implications of living with an undiagnosed condition for some time. So that can be quite difficult for a long time. Finding out that you have cancer is also, you know, I don't need to be a Rhodes Scholar to tell you this, but that's obviously very anxiety provoking. And safety, that sense of safety is really at stake. That's, you know, the big questions that people ask when they're diagnosed is, well, how bad is this for me? You know, what impact is this going to have on my life? How is this going to impact my ability to be a parent? How is this going to affect my ability to work, to earn an income, to function, to be able to go out socially without needing to visit the bathroom 600 times? Like, there's big questions around everything from, you know, am I going to be able to survive with this, but right through to the practical implications of day-to-day living. And it's a lot to get your head around. So we know that in any cancer diagnosis, but particularly in this, there's a huge anxiety response at the start. What we find is that for most people, as you get information, and we need information from all of the medical tests and investigations, often there's some waiting to see a doctor who knows about your condition. We get a treatment plan, we get some printed information, and usually that anxiety does dissipate over time. But what can happen for people with cancer is that it's almost like you get into a bit of a loop where you know, it's different from other anxiety where you know, we can do things to kind of help you. Well, we can do things to help you with cancer anxiety, but I guess the thing is, you've already been traumatized. You know, you've already found out that something terrible has happened to your life, that something life-changing and potentially life-threatening has happened. So your body is more tuned in to potential reminders of that and that thing happening again. So it's like walking past the house of a barking dog and and that might be a bit anxiety provoking if that dog looks particularly fierce. But if you've been bitten by that dog in the past, or a dog in the actually, if you've been bitten by any dog in the past, you probably will get a higher anxiety response than if that's your first, you know, you've never seen lots of barking dogs all your life, but you've never had a problem with them. But also, if that particular dog has bitten you in the past, you're probably going to find a different way to walk. So with cancer, we find that sometimes we get those flare-ups in anxiety when things remind us of the initial thing. And so for a lot of people, that can come at places like having scans, having checkups, having blood tests. It's normal to feel anxious about those things because, you know, you're in a position of uncertainty. But also we find that it can actually really re-trigger the trauma from the original diagnosis. So that can happen too, and it's difficult to deal with. So I wanted to talk a bit about how we manage anxiety, because obviously this is really common for people with NETs, and it's really important that you've got information about how best we can manage it. The first thing I think is really important is just to acknowledge it, just to go, yeah, this is a thing, and no wonder I'm feeling anxious, because, you know, the thing that probably many people are frightened of has happened, and you know, there's a lot to process. There's a lot to get my head around. So yeah, I'm feeling anxious, and sometimes even just saying it out loud can actually really help just take some of the sting out of it, because sometimes these feelings, the more we squash them down, the worse they get. And you know, then it's like putting a lid on a pressure cooker, and you find that there's little explosions of weird and random behaviours when you don't necessarily want them to come out, just because it's got to kind of escape somewhere. The tension's got to escape somewhere. So sometimes just acknowledging to yourself and to other people, saying, look, it's a really anxious time, and I'm not probably at my best, and I'm probably a little bit irritable. I'm not sleeping that well. You know, can you bear with me? I think the other thing is that it's really important to know that you do not have to do this on your own. Just because anxiety is understandable and actually probably arguably normal doesn't mean you just have to put up with it and, you know, put on your big girl pants and suck it up, because you do not have to do this on your own. So getting support for anxiety is so important, because we know that if we can manage that well in its early stages, like lots of things, like pain, like nausea, like depression, if we can manage it well at the start, usually that means we'll manage it more successfully ongoing. What we find hard is when there's a really big ingrained passion, because you know, it's much more difficult to shift. So getting support, and there's support available both, I guess, psychologically, but also medically, and we'll talk about both those things. So we know that for people with anxiety, it can be really helpful to be talking to lots of people, and that goes from everything from engaging with a support group, which I know that lots of you are doing by watching this video and being part of the Facebook private discussion group with neuroendocrine cancer. That's a really big and important strategy for managing anxiety. I'm going to come back to that support group in a minute, because we'll talk. Well, I'm going to come back. But sometimes when the problems are so big and they're not being settled by just talking to peers or family and friends, sometimes it can be really helpful to talk to a professional. And so I'm talking about a counsellor or a psychologist. And we know that, again, talking to a psychologist and doing some structured work with a psychologist or a counsellor can be really very effective at managing anxiety, and sometimes that's the only thing that we will need to do. So quite often we won't need to use medications or other interventions, because the strategies and the work that you'll do with that counsellor or psychologist will be enough to set it back in place, which is not a complete absence of anxiety, I might add, but it's actually about just being able to manage with that. But as I said, sometimes we've engaged with a support group, we've got some peer support, we've enlisted the support of our family and friends, we've talked to a psychologist or a counsellor and done that work, and it's still proving to be a really big problem. There is medical support available. Now, there's quite a lot of different medications that can be used for anxiety. Now, some of them are very short term, and we don't like them to be used on an ongoing basis. Other medications can be ongoing. So there's actually quite a lot of antidepressants that also have an anti-anxiety effect. Now, if you're on an antidepressant and you're still feeling anxious, it doesn't necessarily mean that you're on the wrong medication. Sometimes the dosage level for depression is different to the dosage level of anxiety, and sometimes people will go on to an antidepressant and that'll calm the depression down, and then you start to realise, oh my goodness, I'm realising there's a lot of anxiety in the mix as well. And sometimes the depression was the thing that really made you seek the help in the first place. So it's always really important to keep coming back to your doctor who's prescribing those antidepressants and checking in about the dose. Is the dosage still working for you? Is it covering both depression and anxiety if that's a problem? Is there another? Do we need to add a different drug into the mix? Do we need to try something else? Now, a question that we get a lot at Neuroendocrine Cancer Australia is, given so many people have tumours that produce serotonin, is it then dangerous to use an antidepressant that affects your serotonin levels? It's a really good question, and I get questions from health professionals about this as well. So this is a question where there's legitimate concerns, because nobody wants to make someone's carcinoid syndrome worse. So there's a couple of things to say about that. The first thing to say is that serotonin does not make tumours grow more quickly. Now, that's something that people ask me a lot. In fact, last week I had an email saying exactly that, and the person writing the email said, should I stop taking my antidepressants because they will make my tumours grow more because they are an SSRI or a serotonin impacting antidepressant? And the answer is no. Don't stop taking your antidepressants, and please do not stop taking anything without talking with your doctor. importantly, withdrawing some antidepressants quickly can actually be quite medically dangerous. So you do need to talk with your health professional if you are fiddling with the dosage there. But serotonin doesn't make tumours grow more quickly. Tumours can produce serotonin, and so we get symptoms from them. And we get worried about those symptoms. We don't like the symptoms, that's for sure, but they won't make the tumours grow more quickly. That's really important. There's also very limited evidence to say that antidepressants that impact on the serotonin levels change anything for people with NETs, more than just very occasionally every now and again. And there's actually been some research done in that area. And so if people are interested in the link to that information, I'm really happy to give you a signpost to it. There's journal articles, so it's all in medical jargonese. But if you're talking with a health professional who is feeling reluctant or nervous about prescribing you medication to help with your mental health, then that might be a useful thing to be able to take along with you to that conversation. The other thing I would just say is that lots of you who are around me a lot will know that over the last year or so we've been working on some revamped clinical practice guidelines for the management of neuroendocrine tumours in Australia, and there's a new chapter that's been written looking at psychosocial care. The chapter's actually written by Professor Jane Turner from Queensland and myself, and we've collated all of the evidence around things like that, as well as lots of other things related to psychosocial care and neuroendocrine tumours. That's in its final draft stage. That whole document, the big, everything from nuclear medicine to surgery to psychosocial care and diet and exercise, it's all being just in its final review now. So we're hoping that that will actually be published in the next couple of months, and that hopefully will be quite readable, both for patients as well as for health professionals. So there'll be more resources available about that issue soon. But I guess there's two more things I would want to say about that. The first thing is that there are other medicines that can be used. If the doctor's concerned about your serotonin levels and giving you unwanted symptoms, with medication, then there are other alternatives that don't impact on serotonin levels. That's it. If they say to you, no, I can't prescribe you anything for your mood because of your serotonin producing tumours, then that isn't the case. There's a second thing, and it's just flown out of my head, so I'm going to come back to something else, and I'll circle back at the end and see if I can fish it back out of the recesses of my mind. You never know, it might come back. So I wanted to talk about some other practical strategies for managing anxiety, because we've talked about seeing a psychologist and we've talked about seeing a doctor, and those things are important. But there's also a whole heap of things that you can do. And if you've got that low-level underlying anxiety that's just annoying, but it's not bad enough to go and see anyone about, there are definitely things that we know can help that you can do at home as lifestyle things. So I'm just going to talk a bit about those now. The first thing is breathing exercises. So, and this is going to sound really fish slappy, and I'm sorry, I don't want to sound like I'm just like, oh, we should go and sit on a mountain and it's not actually like that at all. Actually, what we know is that doing controlled breathing exercises can actually help reset some of those problematic hormones that might be running riot. Not the hormones that are being produced by your neck, but the hormones from your adrenal glands that might be going rogue. So doing some slow and measured breathing can actually slow down your physiological response and slow that anxiety down from a physiological standpoint. So it's not just that it makes you feel nice, because most of us, if we're sitting there doing breathing exercises, half of our brain going, why am I doing this? This feels stupid. But there is a really good reason to do it. So I'll make sure in the notes there's some links to some helpful breathing resources that you can look at. But one I will mention off the bat is a resource called Smiling Mind. So there is an app that you can get free on Android or Apple called Smiling Mind, and there's heaps of free exercises that you can listen to. You can choose a male voice or a female voice, and there's ones about sleep and there's ones about all sorts of things, but there's lots about breathing. So I would really encourage you to check that out. I'll make sure there's a link in the notes. Another exercise that can be really, or actually exercise, just doing regular exercise is also something that can be really helpful for anxiety and depression. So your mental well-being in general will benefit from regular exercise. But the exercise that particularly I wanted to talk about was progressive muscle relaxation. Now, some of you may have done this before, but for some of you it may be new. And what it essentially is usually lying down, or you can do it from a comfortable seated position as long as you're well supported. And it's progressively starting from your toes and your feet and moving up your legs. What you're doing is you're clenching muscles really tight for a few seconds and then letting them go. And so we know that starting from the feet and working up towards the top of your head, just doing that slowly, that can also just help release some of that anxiety and tension in your body and help. I mentioned exercise before, but I want to talk a bit more about a healthy lifestyle, because sometimes the things that we sort of want to do when we're feeling wound up and anxious, sometimes they don't do us any favours. And I'm talking about things like drinking alcohol. I'm talking about eating rubbish, high processed, very simple carb food. I'm talking about smoking. And so those things, sometimes they're the kind of the easy grab leap tos. Well, I feel rubbish. I'm going to have chips, or I'm going to have a glass of wine. I'm so stressed. But we know that those things can actually have a negative impact on your mood and your physical well-being, which will flow into your mental well-being as well. So we know, look, everyone's got a day where they're just going they're hitting the chocolate, and there's no two ways about it, but chocolate's full of caffeine. So that's actually going to increase your level of anxiety. So where you can, see if you can swap it out for something a little bit more nourishing, and we'll see if we can swap in some of these other behavioural things as well, like the breathing and the progressive muscle relaxation. The other thing that I wanted to, another thing that I wanted to talk about was self-talk. So, it's lovely when we've got someone in our lives who is telling us, who's being our cheer squad and saying, oh gosh, you're doing a great job, Bob. Like, just look at you. You're getting through all of these really complicated, difficult, painful, issues, and just look at you. You're kicking every goal. You've even made your bed today. Like, go you. And look, you had veggies yesterday. That's incredible given all of the circumstances, So it's lovely to have someone in your life like that who is like your personal cheer squad. I don't know about you, but I don't have that every day. Although, I get heaps of people telling me I'm doing a lovely job, But the thing about living with cancer is that you don't necessarily have everyone noticing all of the good things that you're doing, all of the things you're doing right, all of the things that you're doing awesome at. Like, Mal, you managed to be on time for that appointment. The receptionist never says that, do they? Like, they don't say, oh my goodness, you did so well. Like, it's raining outside. How did you manage to be on time? And so, you put so much effort into just kind of managing to keep a nostril above the waterline. And there's no cheer squad often saying, go you got out of your pajamas. So sometimes you've got to be your own cheer squad. Sometimes you've got to be that voice in the background going, wow, you're wearing clean socks. Like, wow, you did the washing. Wow, you've got fresh food in the fridge. Wow, you've made your way through. You've done that round of chemotherapy. You've done that round of PRT. That was bloody hard. And you're awesome for doing that. So sometimes it's about being your own cheer squad, especially if you haven't got those voices. And we know not everybody does. Like, we're all surrounded by people who are also dealing with their own stuff. And so not everybody's got that. Sometimes when there are things to worry about, and we know that when you're living with cancer, there are, we can't pretend that it's all sunshine and roses and all fine. Sometimes a strategy that can help is planning your worry time. So that might be that you give yourself, depending on how much you've got to worry about, but it might be that you allow yourself 10 minutes or even half an hour of worry time, and you're going to set a timer for it. So 3:30 this afternoon is when I'm going to let myself go into all of the what ifs. That's the time today. that I've got scheduled. I've got, I'll put the phone on silent, and I'm actually just going to sit down and probably think about it. Make a list of all of the things that are really bugging me. And so, because the thing about anxiety is that it wants to self-perpetuate, and a lot of us will have thoughts that just keep coming back into our minds unbidden, unwelcome, but they keep coming back and back and back. And so, sometimes, not always, but sometimes it actually works to be able to just gently put them aside and say, no, I'm coming to you. You just have to wait till 3:30 this afternoon, and then I will give you some airtime. But right now, I'm busy. I've got other stuff to do. I'm enjoying stuff at the moment. Stop bugging me. Thoughts. I'll come to you. And look, as I said, it doesn't work all the time, but sometimes that can be a useful strategy. Getting support I've talked about. And I think I've talked a bit about being kind to yourself. So, I've talked about the self-talk, but sometimes it's actually doing some of the other things. That, you look, in a perfect world, we would have people do these things for us, our minions. But I'm talking about something like maybe giving yourself a hand massage, or maybe rubbing nicely, a cream that smells nice to me. For some people that might be diesel scented fuel smells, but for other people it might be lavender. But giving yourself some nice sensory experiences. With cancer, we get a hell of a lot of medicalised touch. Like someone's always taking our blood pressure. We've all constantly got people lurking around our veins wanting to stick needles in them. Most of you have to bare your bum every month to get an injection there as well. We have all sorts of invasive examinations. People are doing rectal examinations. They're checking out our genitals. They're listening to our chest, and we've got to pull our top up and expose our vulnerable inner skin. But often we lose out a bit on gentle and loving touch. So I guess, it can be reminding those around you that, hey, is a hug on the menu today? I just love a hug. Or, some gentle holding hands, just to get some physical touch in your life that's not medical. But sometimes, as I said, we don't live in a perfect world. So sometimes it's actually about doing that for yourself. And sometimes it's just about, you can actually hug yourself. And look, that sounds weird. And if you're in a public place, people might, well, it's a way of achieving social distancing if it's COVID time. but actually sometimes just giving yourself a hug and just going, okay. It's remarkable how much of a difference that can make. And so sometimes we can't rely on those around us. We haven't all got that team of minions who are waiting on our every breath to do these things for us, but sometimes we can do some of these things for ourselves. The other thing I just wanted to talk about is humour. That is so important because it's like oil and water. It's pretty hard to give a really, really, really good laugh if you're feeling pent up and anxious and worried. So sometimes watching a really silly comedy, I know for one of my friends it's Fawlty Towers, and I'm like, oh, do we have to? But, that's the thing for her. For some people it's listening to a humorous podcast. For other people it's watching your animals, engaging with your pets, watching them, nothing much funnier than watching a dog chase its tail or a cat chase its shadow, or, leap into the air because someone's had the audacity to put a zucchini in the room. Putting a sticky tape square on your carpet for your cat to go and sit in and watching them do that. Going to a park and watching kids, have the best fun on the play equipment. And actually getting outside in the sunshine and the fresh air can be also really, really fantastic. Getting some sunlight on your skin, not in the middle of the day if you're in Australia because sunburn, but certainly getting natural light on your skin is really important for that well-being, that psychological well-being stuff. But doing something that makes you laugh is really important. And I would just, I've talked about this before in our group space. I know a lot of people find it's great to be able to share funny things, funny pictures, funny memes. Just a gentle note that not everybody finds funny the same thing. So in our support groups, we try and create a space to share funny things, but we want to keep that humour really gentle. So just that's my little message if you're watching from Facebook private discussion group land. if you're putting up something that's funny for you, just bear in mind, some people might be in a tender spot and might not find the same thing funny. So just do that thoughtfully, I guess, is the thing. So we've talked about lots of lifestyle things. We've talked about, the value of seeing a psychologist, maybe visiting your GP and getting a mental health care plan so you can see a psychologist for less money. But I wanted to talk specifically about, well, how do you know how much anxiety is too much? Like, how do you know when to get help? And this goes for depression and distress in general. So I know I'm focusing fairly specifically on anxiety today, but other mental health distress as well. So I think that the tips are, if you're having trouble functioning, like if it's affecting you daily, that it's just dragging you down every day, it's time to get some help. If you've lost the desire to do things that give you pleasure, so before when I said do something that makes you feel nice, whether it's rubbing nice hand cream in, whether it's asking a loved one for a hug or giving yourself a hug, whether it's being your own cheer squad and pointing out all of the things that you've actually managed to do today, if you're finding and the things that you're finding, having a good laugh at things, if you're finding those things aren't sparking you up in the ways that they would normally, that they should, it's time to get some help. If you're feeling depressed or anxious nearly all of the day and nearly every day, it's time to get some help. If you find that you're relying on alcohol or drugs, it's definitely time to get some help. If you stop eating regularly because of your psychological distress, it's definitely time to get some help. If you're sleeping too much or having trouble sleeping, and that might be having trouble getting to sleep or waking up in the middle of the night and just worrying, or just finding you can't just get the mental energy to face the day and get out of bed, it's definitely time to get some help. The next two are really serious ones, and I do need to take these really seriously. But if you ever have feelings that you either want to hurt someone else or that you want to hurt yourself, these are not normal. These are not okay. We can definitely help you with these things. You do not have to put up with those thoughts. They're so scary if you're thinking those things. It's time to get some help. And so, well, what do you do to get help? Well, the first thing is talk to your GP. GPs have had, most GPs have got actually quite a lot of training in assessing and helping people to manage that first level of mental health care. So they're really good at that. It's actually, mental health concerns are one of the most common reasons people consult GPs. Now, I know not every GP will be up for that conversation, but your GP is the first port of call. There are also support lines that you can call, and I'll make sure that that Lifeline and those lines are in the notes. But don't hesitate to call them. Lifeline is there 24 hours a day, 7 days a week, and they will help you link in and get the courage and work out what the next steps need to be for you. In terms of your nets, you're always welcome to call the net nurse line. Now, the tricky thing with calling that number is that most of you, that can take a couple of days for someone to get back to you, but we will answer your call, and it can be really helpful to talk to someone. I think the other thing is, talk with the group members. If you're in the Facebook private discussion group, or if you're in a face-to-face support group, talk with those people, and they will be part of your cheer squad. And the other resource that I always want to make sure I mention is the 13 11 20 service provided by Cancer Council, because they are Monday to Friday, and they're usually 8:30 or 9 depending on the stage. It's 2 till 5 or 5:30 again depending on the stage. But they have qualified health professionals who answer those calls, and a bit unlike the net nurse line where you will have a couple of days to wait to talk specifically to me. You'll usually be able to talk to someone. They usually pick up the phone straight away, but if they don't, then there's usually only a very short wait, and they've definitely got the training and skills to help you navigate that stuff. So I hope that's helpful. I'm really sad I couldn't see the comments because I know people are watching. So I'm just going to actually just bear with me for a sec while I just look at my phone to see if I can see any comments there, but I can't, so that'll just have to be the way it is. Look, I hope that's helpful to for you in managing what is a really very common issue for people with NETs. Most people will have anxiety at some point in their lives, especially if there's cancer in the scene. And also I did want to mention that carers are just as prone to experiencing anxiety as the person who's got the cancer as well. So if you're a carer and you're watching, just maybe rewatch the video. I know I've talked about this all as the perspective of the person with the tumour, but it's just as relevant for you as a carer, maybe even more so, because when you're a carer, the focus is on the person with the cancer, and sometimes you're lacking that cheer squad telling you you're doing a good job. And look, we know you are. We know you're doing an awesome job, but sometimes you need to hear that out loud more frequently than you do. So don't hesitate to reach out and get support if you're a carer as well. So look, I'm going to leave it there. I hope you all have a great week, and I will look forward to seeing you next week. Next Friday, I want to talk about something that gets said in our Facebook private discussion group a lot. It's also been talked about in our carers group, and actually did a little video update in our carers group to talk about it specifically in there, and I thought, now this is time to bring it back into the broader space as well. That's the mantra of never ever give up, which has been kicking around neuroendocrine cancer circles for some years. I want to give some background to that because not everybody has been around that long and knows the story behind it. But I also want to talk about the context for it, and ways in which different people might find that helpful to grab as a bit of a motto or a mantra. And these are, in different situations. But also, I want to talk a bit about when that doesn't feel like it's the best thing for you and what we can do with those feelings as well. So, look, that's something that I've wanted to do for a little while to address in our communities. I know if you're watching via YouTube later on, that might not be something that immediately springs to being relevant because you haven't been part of those conversations. But I would encourage you, if you're watching on YouTube next week, or if you've been watching the series on YouTube, then maybe tune in next week because maybe there will be some stuff that's useful for you as well. So I'm gonna leave it there. It's lovely to see that there's people watching. I'll look forward to reading the comments when I find some decent Wi-Fi. So take care, everyone. Have a great week.